Identify the best time to conceive using ovulation tests. Your body produces LH, luteinizing hormone, every day during your cycle, and you will always have some amount present in the urine. That is why you will see a test line on most of your tests. This is a healthy sign. Just remember that the result is considered positive if the test line is at the same intensity or darker than the control line. In order to be sure if the test strip is showing a true positive result, it is important to continue testing after you receive the same intensity lines. The test line may become even darker than the control line, or it may become pale again, indicating that the previous test result was a true surge. The positive test color line may vary depending on the individual. While some ladies can see the test line match the control line prior to their ovulation peak, others see test lines away darker than the control one. Some women have surge levels that are below 25 μml, low LH surge. In that case, your LH peak is your darkest line of all the results. For some women, LH surge can last a couple of days, while for others, it only lasts about 12 hours. Please keep in mind that every cycle is unique. Some women do not ovulate every cycle and will not see an increase in LH levels during these non-ovulatory cycles. Some prescription drugs may affect the result, such as monotropines for injection, Pergonal, and danazol, Denocrine. If you are using clomiphene citrate, e.g. Clomid and Seraphine, consult your physician for possible interference with the test. Some rare medical conditions and/or the onset of menopause can cause elevated LH levels. Some women do not ovulate every cycle and will not see an increase in LH levels during these non-ovulatory cycles. You should not be using test strips to track ovulation if you have PCOS. You may get unclear results. Home urine ovulation tests are not suitable if you have recently been pregnant, reached menopause, or have PCOS. If you have PCOS, you may have a constant high level of luteinizing hormone or multiple luteinizing hormone surges. The results can falsely reflect whether or not you have ovulated. Women with PCOS often don't ovulate, or at least not regularly, and have irregular or infrequent periods. If you are not ovulating, then the egg is not released from the ovary to pass into the fallopian tube in order to be fertilized and implanted in the uterus. Ovulation patterns differ with each woman's specific body type and menstrual cycle. You should reduce your liquid intake approximately 2 hours prior to testing. Also, urinate into a clean, dry cup or container.